Net proceeds from our show, Sports Medicine Weekly, go to support orthopedic research at Rush through the liveactivenow.org fund. Our producer, Shane Reardon. Coordinating producer is Tracy Toro. I'm Steve Cashel with Dr. Brian Cole at Sports Medicine Weekly, Chicago's premier sports medicine program. Time now for our staple of the show, Ask the Doctor, the segment we do each and every week, giving our listeners opportunity to have Dr. Cole address their specific sports injury issues. Very easy to get involved. Go to our website, sportsmedicineweekly.com. On our homepage, you'll see Dr. Cole and yours truly in a picture on the right side. Click on that link, and you can ask the doc a question. Question number one, Doc, you ready?
I am ready. Let's do it.
All right, Dr. Brian Cole, Advil bothers my stomach, this listener says. What kind of anti-inflammatories can I use besides Advil?
It's sort of a two-prong answer, Steve, because you could also switch anti-inflammatories, and there are some that may have less gastrointestinal side effects. So that's the first option. You got to work with your doctor. But I think what this listener is getting at is they would like to know if there's sort of any non-true pharmacologic or drug options to reduce inflammation, and there are. And this is an area that I have particular interest in. There's three things that come to mind. One is turmeric, and turmeric's a fascinating one. You find all sorts of turmeric out there, and there actually are some very good basic science and clinical studies that turmeric can reduce inflammation in patients with osteoarthritis. And now I recommend it to all of my patients.
Can it come in tablet form?
It's a pill form, yeah.
Oh, good.
So you can't get enough seasoning to ever do it. So it's curcumin is the formal chemical name. And there's actually the most evidence with this agent over the counter. It's not a drug. It's not even a medical food. It's a food, and it's not highly regulated by the FDA. But curcumin or turmeric probably has the most data, very safe. I hardly ever hear a patient say that they have any issues with that. So that's where I would go to first. The second one, which has a little less evidence, it's an Asian, probably comes from Asian heritage, is just the use of ginger. And that has what we call a cyclooxygenase. Cyclooxygenase is in what some of the drugs that we can get prescribed, but it has these enzymes that can limit cytokines, which are the inflammatory mediators. So the use of ginger can be particularly helpful. There are studies that using ginger for the treatment of arthritis and associated pain from inflammation, and it can come in the form of tablets, capsules, and teas as well, right? And the third one is green tea. Green tea is awesome. It has linked it to a variety of health benefits, such as adding to weight loss. If you're going to do intermittent fasting, for example, having green tea as part of the program is a really good one to do. And there's a component of green tea that actually can inhibit inflammation in patients with arthritis. So those are the three things that are particularly useful. Not much in the way of risks, quite frankly. I think patients rarely have any significant risk with these. So turmeric, green tea, and ginger are probably the three best known and three most researched non-pharmacologic, non-drug options for people to reduce inflammation.
Let me take you a step further, ask you about my situation. You did surgery on me 8-9 weeks ago on my right shoulder. The biceps tendonitis, tenodesis is what you call it. All right, so I'm still every now and then when I go through my physical therapy or wake up, painful at night, I'll quickly pop 3 Motrin. And it helps a lot. But
Motrin's awesome.
Okay, but is this something like the turmeric? Is that something we have to add up to? I mean, I just can't take a turmeric.
Yes,
it wouldn't be
why
the same.
Try it?
Would it be the same effect as
Look,
3?
Motrin is a great drug.
Okay.
But anytime you can get away from a drug, just like anytime you get away
I don't
from
like
surgery,
to take it. I hate it.
So if I were you, I would, you go to the store. The problem is there's a lot of product confusion out there, and I can't recommend one versus the other.
Look for something natural, I'd imagine, right?
But I would start with turmeric. And and I would say that's the one that most of my patients use as an alternative to a drug.
But I'm thinking that you would have to take a number of them for it to add up to something.
Yeah, and I have no...
I'm not talking about 3 pills compared to 3 Motrin, but is that something you would have to...
Yeah, there's potency issues, and I can't really give you much on that other than saying... Fortunately, read the bottle. I don't know if you can overdose on turmeric, quite frankly, but I would probably read the bottle. I mean, there are GI side effects you can get, but you're not going to get a bleeding ulcer like you can if you don't tolerate Motrin or some other anti-inflammatory because of the side effects to the stomach lining.
And what about extra-strength Tylenol compared to Motrin?
So Tylenol is awesome because it's not an anti-inflammatory, it's a pain reliever.
Yes.
Acetaminophen. The flip side, Tylenol can be problematic because it can be very toxic to the liver if you're taking excessive doses. So, but I always
So it
encourage
gets rid
people,
of the pain, but it
Yes.
doesn't do the anti-inflammatory.
Tylenol can get rid of fever, and it can get rid of pain, muscle soreness, things like that. So you can't forget about Tylenol because it's really well tolerated. But the downside is that in excess doses, it can cause irreversible liver damage.
Okay. And one other question about that. You told me one time, take 3, when I was going through my post-op with the surgery, take 3 Motrin every 8 hours.
Right. If I was to prescribe it,
get
that's a prescription dose. If you get over the counter, you can buy the 200 milligram pills. That's how they come.
Yeah.
And the dose is 400 milligrams every, say, 6 to 8 hours, right?
Okay.
But a prescription dose can be 600, 800. It's one big, it's kind of a horse pill.
Yeah.
So what I will do is prescribe patients to say, look, for the short term, post-operatively, to reduce the narcotic need, let's have you take 3 to 4 Motrin or Motrin or Advil or ibuprofen, all the same things. It's cheap. Take it with food. You can buy big bottles of it. And you don't want to do this in perpetuity, but this is in the acute post-operative state. And I would rather have that, as long as your stomach can tolerate it, as opposed to taking a narcotic. So did you do it when you did it post-op?
I did, yep.
Yeah, it's such a
helped
good,
a lot, but
you can manage surgical pain with Motrin. And obviously no medicine, you'd love to be off all medicines, but if you're comparing two evils, I would take the anti-inflammatory.
great stuff. All righty. Dr. Cole, we appreciate it. Many thanks to our producer and board operator, Shane Reardon. We are out of time. Our coordinating producer, as always, Tracy Toro. Also want to thank David Cole and Samantha Smith for managing our website and also our business operations. For Dr. Brian Cole, my name is Steve Cashel, saying so long. Thanks so much for listening to us here on Sports Medicine Weekly on The Score. Up next, Early Odds with Joe Ostrowski. We'll talk with you again next Saturday for another edition of Sports Medicine Weekly, only on
670 The Score.